Guys, welcome back to Roseby Group Limited YouTube channel. We are on another topic today on the other side of the mic, and today I have our host once again, Dr. Roy Cabello Simo. You can say something. Hi, how are you?
I'm good, thank
you.
You're
good?
Very well, thank you.
Okay, so today we have a very interesting topic to discuss, and we're going to talk about family planning, something that is also very controversial and also very challenging to most of the people. So that is what we're talking about today. So take it from here.
Family planning encompasses of various varieties of methods and services aimed at helping couples, individuals to achieve the number of children they want to have, and the spaces between the pregnancy gaps and overall reproductive health. So it is a very big topic that if we are not careful, we may make mistakes as people, and even guiding people. There are types of methods on which we do family planning, and you have the contraceptive methods, which you have other like barrier methods, which is the condoms. You have the male and female condoms, which definitely I know on several places I've been to, you have less of the female condoms being used. And you have the diaphragm and the cervical caps, which also is a device placed inside the vagina to cover the cervix. And diaphragm and cervical caps.
That's interesting. That's new. I've never heard about that.
Okay.
Is it intrusive?
Yes, it's intrusive because you place inside the vagina to cover the cervix, such that it blocks sperm from going through.
So it's okay. Continue.
Okay. Now you also have the hormonal method, the birth control pills, which are taken daily to prevent ovulation. You also have the contraceptive patch, injections, Depo-Provera. You have the vaginal rings. So you have implants too, and then those are under the hormonal method. You have the intrauterine device. Okay, that's the IUDs. The IUDs. So the copper IUDs, non-hormonal, which lasts up to 10 years, and hormonal IUDs, which lasts for 3 to 5 years, depending. You also have emergency contraceptive, contraception, sorry, which is a morning after pill. Yeah.
Okay.
So you take within 72 hours after sex, or after unprotected sex. That is one. The copper IUDs also is another thing that you can do. You have the permanence method. Okay. The permanence method has to do with tubal litigation. Okay, surgical procedure for women that blocks their fallopian tubes to prevent pregnancy. We will come to that.
Yeah.
I'm just trying to make sure that we have. It is called a permanent method because sometimes it's difficult for some people to go back
to the
original state and to do surgeries again because of that. But it is to a percentage possible, okay? Reversible. Now, that is one. You have the vasectomy, which is surgical procedure for men to cut off cuts and seals, their tubes carrying the sperm. So it doesn't stop you from being erected, no. You still have your sperms which are living, but now it can't flow out, so it becomes useless. Okay. Now you have the natural method, fertility awareness method, monitoring the menstrual cycle and determining the fertile days that one could manage it yourself. Where you are like, oh, I know that I saw my period this day, So after the 7 days period, I have to do this. After these days, I have to do this. And after this, I must not stay. If I dare, this happens.
That one.
Okay. Now you also have the long. Now with this, first of all, with these natural methods, okay, you have the withdrawal method. Okay, it involves withdrawing the penis before ejaculation.
Risky.
It's risky, but it's possible for some men. It works for some men because if you know, okay, let me cover some of the little bit of the Bible. The Bible talks about the son of Jacob.
Yes, sir.
Who's the son of Judah, Jacob's son, who had to sleep with his wife, and the brother died. So when he was asked to sleep with the brother's wife to give children, when he was about coming, he pulled out. And God got angry. Hey man, you were supposed to do this. Why didn't you let it flow? Okay. Now that is part of it. You have the long-active reversible contraceptive, the IUDs as mentioned above, and implants are considered like the long-active reversible contraceptives. Okay. Now these are all different types. You have sterilization, male sterilization, vasectomy, and female sterilization, tubal litigation.
That is where you say it can be permanent or it can be reversed.
Yes, you have the dual protection using condoms with other methods such as hormonal contraceptive for protection against both pregnancy and sexually transmitted disease infections. You have family planning counseling. Okay, so many health organizations and clinics offer counseling to help individuals, couples on such.
What to choose.
Yes. So I think with that you get to have the broad scope of
the
options available for family planning.
So you've talked about hormonal and non-hormonal contraceptives. In a layman's language, what is hormonal and what is non-hormonal contraceptive?
Okay. Hormonal contraceptives are such as pills, patches, injections, IUDs, and implants. Okay. There are more that has to do with the direct system of a person. Okay, ingesting things that goes into the system, and some implanting things into the body, like how do I say?
Like they bring a new agent into the system.
They bring a new agent. I want to use not parasite. I want to use the word alien into the system. Okay. They bring a new alien into the system, and that is how that is. But the non-hormonal is different from that and has a switch which it goes to what is already there, and you just do one or two things to stop it from functioning.
So those are like more of the natural methods.
Natural methods, yeah.
Okay. So what are the disadvantages of all these contraceptions? Because of late there's been like a wave of the pill. People are really, especially in Africa, they say that the pill is not good for women, right? That it is not a recommended way of contraception. And also so many women are like, if I take the pill, I gain a lot of weight, or my periods take longer to come back, or when I stop getting pregnant is an issue, there's high blood pressure associated with that. So what can you say about that?
Okay, let's look at it this way. Can I just go natural and be free? There is one thing I always like quoting from the Bible, because I'm more Bible related, though science is different. God said to the man, be fruitful and multiply, when he made man and woman. So the position for multiplication is one thing. Knowing how to multiply in order to be able to cater for is another. Okay? Now, if we say we have to be careful on how to multiply, we need to know what we bring into the table.
Okay.
Some time ago, during your last interview, we talked a little about women. We talked a little about women bringing in things into their systems.
Yeah.
And I believe we were talking about natural ways of solving some issues.
Yes.
You understand?
Yes.
So now, at this point, it is different. How and why? Because we want to make sure that we are able to be in a union with our partners, and at the same time, because of our work-related issues, because of finance, because of other causes, we may not want to take in at that point. We want to have a space, because some of us might even be single parents.
Yeah.
So that aspect also, we want to like, okay, we cannot keep ourselves just like that. We need to make sure we do 1, 2, 3 things. Now, in that case, if we must do, we have to be very careful. Why careful? Because the medications we talked about, like the last interview, I made an illustration. I said 60, 50 to 80%
Yeah.
of the medications we inject in our system, we take part of it are chemicals to preserve that medication.
Yeah.
Now, the other part of it is the medication. The other part of it are chemicals. Now, those preservations that we keep ingesting in our system, the aliens we keep bringing into our system, has their own effects. And if you remember very well, I quoted that the liver is a sieve.
Yeah.
The liver, being a sieve, takes in what is needed, and if not flushed out the chaffs, automatically it accumulates and becomes a blockade.
Yeah.
Now, in this case, when we talk about contraceptive, we need to be careful and we need to be sure who is the manufacturer.
Okay.
What products are we being recommended to? Why are we being recommended to this kind of a product? There is one thing I always tell people. 100,000 people could be right, could say one thing, and you stand alone to say another thing. Does not mean they are right and you are wrong. You need to know how to stand on the truth. You need to know how to face reality. Now, like you mentioned, there are a lot of things that happen during contraceptive. Inconsistent menstrual flow.
Yeah.
You discover your menses comes today. It's irregular. I have had patients ask me, "No, I took this, but now I have irregular menstrual flow. I used to see my menses on the 28th, but now I see it on the 15th. After it comes on the 14th, now it's on the 12th.
Yeah.
It's irregular, it's inconsistent. And it used to come for 5 days, now it comes for 2 days. Should I be worried? You understand? Now you see some people, very beautiful ladies, at one point just start developing pimples on the face.
Breakouts, yeah.
You understand? You see some others with, at one point you see today they are bloated.
They're pregnant.
And after a while you see they are flat back.
Yeah.
So what is happening? These are the effects of not just the medication, but the preservatives that are in those medications. Somebody would ask me, but what do we do? Go natural. I still sing that like a song. Go natural, because when you go natural, you stand to be in a position, place yourself in a position whereby you know that this is what I can do, and this is another thing I cannot do. Okay. Now somebody will ask me, Doc, what are the natural ways of doing this? These are questions that I will answer maybe at the end, and I will keep some records so that people get to understand. But I don't want to tilt away from the question, but know that we have the advantages are there, and then just because you want to prevent having children, you take some risk that will bring you more risk in the nearest future. You understand?
Yeah.
And let me give you a shocking analysis. As a matter of fact, I gathered this from one of my very good medical friends who is also a researcher. And he made me know that a lot of women with contraceptive end up having cancer in one way or the other. Just know that the advantages of hormonal contraceptives, you have the high effectiveness, you have the convenience, you have the regulate menstrual cycle, you have reduced menstrual pain, okay?
Yeah.
You have, yes, it does. It does.
Well, that's why it's used in the other, what do you call it? The other topic we discussed. Endometriosis. Yeah.
So you have improved skin health. Okay, that is now the hormonal. Okay, improved skin health to an extent. You have reduced the risk of certain cancers. Certain cancers.
Okay.
It reduces the risk of certain cancers. You have the threat hormonal disorder. You have, then the disadvantages, it's the side effects, common side effects. You have serious side effects too, these are different. Nausea, breast tenderness, mood swings, weight gain,
Backache.
Yes. Weight
And headaches.
Especially with the initiation period. Then you have serious side effects, which is the increase of blood clots, stroke, high blood pressure, and
in periods that don't go away.
yes, and especially women who smoke and are over 35 years old. Then you require consistency, okay, for the birth control pills that require strict daily adherence. You also have, it does not protect against STIs, okay?
Yeah.
You also have, it may affect libido. I just hope you know very soon we will discuss on orgasm.
Yeah.
And then we'll address this thing.
Interesting.
We'll address this thing on libido, how it affects it. Okay? And then delay return onto fertility, because sometimes after you've done it, now you say, okay, I want to take it off, I want to conceive. You discover that the more you try to want to do it, the more you discover it can't go. And then what is happening? You start going from one prayer house to the other, one pastor to the other, looking for how to conceive, but yet forgetting to know that this is one of the things you did yourself. Now, it has the risk, in the increased risk of certain conditions, potential weight gain, mood change. I've spoken about that one. So yes, I think those are the advantages and the disadvantages.
I think we've talked about it a little bit. I can just ask it, right?
Question two.
Yeah, so what are the natural family planning methods and how does it work? How effective is it?
Natural family planning
Yeah.
refers to methods used to avoid or achieve pregnancy by tracking natural biological makers of fertility. It does not involve any drugs, device, or hormones, making it a natural and non-invasive method of family planning. Okay?
Yeah.
Now, couples monitor their women menstrual cycles and identify the fertile and the infertile phase.
Yeah, I have a question.
To either engage, you understand? And then now, to either engage or avoid intercourse, okay? Yeah, depending on their pregnancy goals. Now that is natural.
Let me just ask a question. So the natural family planning method. Like let's say for example the counting of days. You cannot limit a man and tell them, or limit yourself, like I will not have the urge to have sex until my days are right, like till I'm on my safe days. So how do you go about that? Like it has come, and it's not yet like your safe days.
Okay, let me answer your question in 5 different ways. There are ideas, okay? And please, don't use this to misunderstand me. But I'm going to answer genuinely from my own point of view. Okay. I want to say that sex is something that is very deep. Okay? And there are ways you can avoid being pregnant if you don't want to. Okay? Now, let's say you as husband and wife, you have come to a stage where you have agreed that you don't want to have children again.
Yeah.
I guess that's your question.
Yeah.
So what should you do? There are different ways, different things you can do. The natural method of family planning, where you count the days of the woman, okay? And when she's safe, you go in. But what if you are like, I need patience and I need patience now? That means you're not patient enough
To wait for the days.
There are things, there's a withdrawal method. You both go into it, and when he knows he's coming, and there's one good thing, when the man is coming, you the woman, you know that the man is coming.
Okay.
And when he is coming, then at that point in time, that you make him, or if he can control, if he has that self-control, the ability to control himself, then it's spin out.
Risky.
Okay.
Position.
Now,
Depends with the position.
that is the withdrawal method. Okay? But it has its risk of failing, of course.
That is what it is.
Yes, that is one thing. Now, another thing is a permanent solution to it. For the men, you can go for vasectomy.
They don't want.
For the women, you can go for tubal ligation. Okay? And you can keep abstinence. No. I'm just, see, I'm giving you
The choices.
choices. Okay? Now, at this point, sometimes it is not from the woman. Maybe the woman is okay, she knows she can wait for her time. The man wants it now.
It is always the man.
It is not always the man. It's both ways. And one thing you get to understand is women enjoy sex more than men.
Okay, that's interesting.
It's a topic we'll talk about.
We should.
Now, women tend to enjoy sex more than men. So if the man is like in need of it now, and you don't want to give it to him, what do you do? It plays in psychology. It has a play in psychology. It has an understanding whereby some women would want to do it, others may not want to. Now, there are, as I started by saying sex is a very deep topic. Okay? Sex is a very deep topic, and if we don't handle it with care, it can cause a lot of problems. Now, penetration is not the only thing that makes sex sex. There are different ways of playing with your partner, male and female. And if you play with the male very well, and he's able to ejaculate, the next thing that comes online is sleep. if you do a good job.
So if they don't sleep, you've not done your job.
That is one thing. And now there is another thing. You can play with your partner, the female, and bring her right up to orgasm without penetration.
Mm-hmm.
You know, there are different spots of penetration orgasm for the woman. I was telling somebody there are 5 different types of orgasms.
Yep. We talk about that.
And it has to do with a lot of understanding your partner's system.
Mm-hmm.
Okay?
Mm-hmm.
You can get a woman can get orgasm just from playing with the breast,
Mm-hmm.
the G spot, and more.
Okay.
So that's the topic we'll talk about it.
Mm-hmm.
So you can practically decide to go this route while waiting for the time to go into penetration.
Should one use family planning before having any children? Because you've had cases where someone postpones their childbirth life because of their careers, because of many reasons known to themselves, but they get to a point now they want to have children, it becomes impossible. Because people sometimes say that it's because you used contraceptives before, like the hormonal contraceptive before, they associate it to that cause. Is it a problem? Is it try to use them before, or?
My advice is, sincerely, why should you?
I'll give you a good example with that question. I live in a place where there's so many teenage girls who right now have become so exposed to sex, right? And now their parents are finding it hard to tame them not to get pregnant because they want them to continue their education. So you find that they're taken to, actually the largest number of people getting contraceptives are children from the age of 12 to 18.
Okay. Who is that? Good. You looked. You looked.
Yeah.
Then if I tell you, okay, don't look at that thing. What is the highest tendency of what you want to do?
To look. Because I'm curious.
Good. If I tell you, don't look at it, you would want to look at it, right?
Yeah.
Now, if I say look at it, what would you want to do?
Wonder why am I looking at it?
Good. That is the nature of man. So if you tell somebody to use contraceptive, you're pushing that person into it. Create a room for dialogue with your daughter. All that. There are ways of prevention. But it's better you go natural. Okay? Educate them. Educate them. And then show them life. I remember when I was small, they used to show me videos of children in Africa with flies everywhere. That was the impression, and I never felt like wanting to be that. But now I've come to understand that, okay, if I don't want to be poor, I need to work hard. Okay?
Yeah.
Because when I was growing up, I got to understand that Africa was poverty.
They're very rich.
Meanwhile, Africa is the richest continent in the world.
Yeah.
So if we put all that, if we align all that together, if we re-educate our sons and daughters, we will be able to monitor and control some things. It is better our sons and daughters get married early and know their responsibilities before they get married. They understand their responsibilities before getting married.
Yeah.
Than for them to jump into it without understanding what it is.
So we shouldn't advise them to have.
No.
What if they have? What is the effect in the near future?
It's 50-50. There's a possibility that you might not be able to conceive easily or have complications. as well as there's possibilities that it might not. It's 50-50.
Can it cause fibroids and...
Okay, that is another topic for its own. It depends on the condition, the environmental condition of the person, the hormonal intakes of the person, the ingestions of the person will determine what parasites comes to stay, what infections comes to stay and grow in the system.
Okay.
People, if you don't want to have children, don't have sex. But if you must have sex, if you must have sex, you need to use a condom. If you must use a condom, you must also know your stand. If you must use a condom, you must also know your stand. And another thing is the emotional and mental. Are you mentally prepared for it? Are you having children? There is a change that occurs, in your system. Are you ready emotionally and prepared for it? Don't just go having children because everybody wants to have children. Is your child coming to suffer, or is your child coming to... So you prepare your mind. Your financial stability is another thing, because you have to choose whether you are up to date, and to be what you want to be. So you put yourself in that position and you get things done rightly. The next thing is your relationship stability. Are you mentally ready relationship-wise? Because there's some relationship where the woman still wants to play her life and do things, or the guy wants to be jumping from point A to point B, and that also you don't want to. And then now you have to consider your health. The health of a mother is one thing you need to consider. Use family planning before having children. It allows a woman to focus on her health and well-being. That is one thing you need to know, But you need to also consider that, while doing this, you also need to think of the after effects. Now you have to give a spacing for your optimal health, such that you know exactly when, how, with who you go. Now your career or educational goals. A lot of people who want to do this because they are looking at tomorrow becoming how do I say it? Financially stable or going to school, so they want to work first before they can start taking responsibilities. So that is why they do it. But now the question is, if you really need to go to school, focus on school. Focus on your education. That's something that people are. So some reasons why people may not choose family planning before having children: the desire for early parenthood. Fertility concerns now. So you see, we're talking two different things now. Yes, you have this benefit if you do it. But if you don't do it now, fertility concerns. Some individual worries that delaying childbearing might reduce their chances of conception. Now, you have the religious and moral beliefs, which are also. Now, what are the medical perspectives on family planning before children? It is safe and common, medically, yes. And the age and fertility also matters. And I think that is the answer to your question.
That is extensive. So are there options for reversible sterilization? Like if one chooses to go the tube ligation way, is there a way that it can be reversed? Like say, for example, they decided I want to take a break and family planning hormonal methods are not working for me. Maybe they're making me sick or they're making me have prolonged periods, and you just want to go the ligation way. And when it comes to saying I want to have children, can it be reversed?
Yes. It is possible. I'll use the words "it is possible." And there can be both positive and negative long-term effects. Associated with the use of various contraceptive methods. So it depends. And you see, for example, the hormonal contraceptive, each birth control pills, patch, injections, implants, hormonal IUDs, okay, have a positive long-term effects. You have like reduced risk of certain cancers, like I mentioned before. You have long-term use of hormonal contraceptive, particularly birth controls, that's been associated with a reduced risk of ovarian, endometrial, and colorectal cancers. Okay. Now, the management of menstrual related disorders. That is another thing. Those are the positive long-term effects now I'm giving you. You also have the improvements in AIDS.
Okay.
Okay. You have reduced risk of anemia.
Okay.
Okay. By lightening menstrual periods, hormonal methods can reduce the risk of iron deficiency.
Sorry, please.
Reduce.
Oh, but I'm losing more blood. How is it reduced?
It can
Okay.
reduce. Now, then the negative long-term effects increase risk of certain cancers. We are losing from this side and gaining from this
the
other side. Now, you see, like cervical, breast and cervical cancers. Okay, increased risk of blood clot. Okay, increased risk of blood clot. It also has a potential weight gain, mood change, and depression. Okay, delayed returns to fertility. Okay, then the non-hormonal contraceptive, the copper IUD barrier method, these now that the positive long-term effects. Okay, no hormonal side effects.
Okay.
Do you understand? No hormonal side effects. That is one you should understand. Then now the next one is a long-term reversible option, copper IUDs. So it is possible.
So copper IUDs is like a long-term.
Okay, the copper IUDs can last up to 10 years. Okay,
Yes.
and it's highly effective. Long-term methods without affecting the body, natural hormonal balance. Fertility returns immediately after removal.
IUD.
Copper IUD.
I've had people say it gives them baby.
It depends. That is why I said the long-term effects.
Okay.
A lot of people have complained. I've had patients to complain, but sometimes if you remember, my first warning was know who you deal with, know what products, and know their effects.
Now the problem is that, like in Kenyan setup, you can't know these things unless
You need to ask. That is why the internet is there for you to find
so
out
the government
options.
hospital doesn't give you options. It doesn't leave you with much options. And I don't know why they don't. They educate you, yeah, but to a certain extent. They will just educate you to choose what is good for you. They will give you the long term time.
I'm sorry to
But
say
if you
this.
ask them the material, whatever that is contained in the product, now they become rude and are like you have to teach them their job. It's a whole, unless they have like that gynecologist.
That is why I said it's better to say it this way. There's something that happens with Africans. Our African brothers and sisters do not really want to read. We need to always cultivate the attitude of doing research, of finding out. Okay? Because it is needed. What is this compound? What is it used for? What is this? What are the effects? What is this? What is this? How do I use it? If not, go natural.
How does family planning contribute to overall health and economic well-being?
Economy. I'm not an economist, but I'll say it this way. In the days of our forefathers, the more the children, the more rich you are.
Yes. Especially
because that is, I am from a polygamous home, and my father had 37 wives. And in our tradition, all of us are supposed to be polygamous. All the sons, 89 boys, and the rest are girls. All of us are supposed to be polygamous if all of us are not polygamous. Okay? Now, you talk about the economy. If we have a very big land, it means we have much food. Our productivity will be much than a single parent.
If we don't have the land.
You understand? So there will be different side hustles. Okay, but now let me go natural. With family planning, it gives you the opportunity to manage your resources very well. You have the opportunity to know that, okay, this is my expenses for my children, and this is my expenses for growth, and this is my expenses for health care. This is this, and we are able to put things in order. Meanwhile, there are also disadvantages of having many children if you're not financially buoyant to take care of them. So we shouldn't just look at one side, but we should look at the positivity of both sides. So I think it has a lot of role to play in the economy.
Okay.
Yeah. Some of which you see, it reduces maternal mortality. Also, those are the benefits you want to
maternal mortality.
Yes, it reduces maternal mortality. It also improves mental health. It prevents.
Okay, so IUDs, the intrauterine devices. There's been so many concerns about it, right? So what are the risks associated with IUDs? Because among all family planning methods, I think IUDs and pills are very common when it comes to side effects.
Okay.
But the IUD has become a concern. So what can you tell us about that? What are the risks of having an IUD?
You see, like for the intrauterine devices, they are generally considered safe and effective for the long-term contraceptive. But like any medical advice, they do come with potential risk. Okay, and there are two main types of IUDs, which we have talked about already. That is the copper IUDs, okay, the Paragat, and the hormonal IUDs. You understand? So, and you should put into consideration that while the risks are relatively low, the importance to be aware of the potential side effects and complications are necessary.
Okay.
Okay. Now you asked of what are the side effects?
Yeah.
Okay. Now the risk associated and their side effects. Let me give you some brief of their side effects. You have the common side effects, which is the cramping and the pain that the woman goes through generally.
It increases.
Yes, after the IUD is in session, crampings and pelvic pain are common.
Okay. Even without having your periods. They just come.
Sometimes they are common, especially in the first few days of the week.
Okay.
You understand, the first few days to a week. But there are some times that it differs with individuals. Okay? Because over-the-counter pain relievers can help. That is one thing. And some women may experience prolonged discomfort on it.
Okay.
Now, changing menstrual cycle is another thing. As the copper iodine may cause heavier and longer period with increased menstrual cramping, particularly in the first few months of insertion. Meanwhile, the hormonal IUDs can lead to lighter period, okay, amenorrhea, no period at all, depending, okay, because some people will discover that when you have the hormonal IUDs, you may not even see your period at one point.
You're not seeing your period. Does it cause any kind of issues in your system?
Okay, I'll ask you a question. If every day you need to send out water from the tap to water the garden. When you stop sending out water from water in the garden for the plants grow, and there is more water coming to you,
but you're
not sending it out, would you still have space? Would you have complications?
You will.
That is it. This feminine cycle is built such that a woman must send out quantity of blood, waste, accumulated waste in the form of blood out of her system. It is a natural phenomenon. Now, the more it accumulates and you don't send out, then you start asking yourself questions. You understand? So it is made such that the more you send out, the more the body can rebuild new hormones, new system to flow. Okay? It's a cycle. When you come to that point, it must go out. It is a cycle. But without it, it's necessary. It's a problem. It could be a problem. And to me, generally, from a personal point of view, it's a problem.
And there are women who do not have any form of family planning if they don't get their periods.
That is a different case. Now, when you don't, then there are reasons behind that. Some of them is stress. Sometimes you get stressed and you have a lot of flu. Some of it is hormonal imbalance. It will cause you to have different situations. Now, but the other women that has it, some will have a lot of flow, others will not have, depending on the system.
That's just okay.
You will never say they are okay.
Okay.
Because there are some cases that when you end up getting a particular kind of a situation, it becomes deadly for such kind of people. So that is why it is necessary that if you have to do certain things, always consult your medical practitioner or your gynae for more information in regards to this.
What about when somebody has given birth? Because there's that experience of you've given birth and then you stay like a period, even 2 years after having experience.
No.
Even a year.
That is so long. When you give birth, naturally, practically, there is blood that comes out along with it, right?
Yes.
Now, I was telling somebody today, and I told the person that when it happens that you give birth, there's normally what they do in the hospitals. They clean you up. They try to take away the excess blood that is in the system, vacuuming once in a while, and so much they can take as much as possible. But the meat system is supposed to be cleaned. Okay. Now, in a case where the system is not cleaned very well, the blood in the system starts getting stopped. Okay. Now, when this blood accumulates and does not go out, it becomes clotted. It starts getting stuffy, sticky, thick. Now, at the time when it needs to come out, you will start feeling like if there's a foreign body, because a passageway is normal. It's no more normal because at that point in time, something is layered underneath of accumulated blood that has not been taken out. And that blood is not like fresh blood, it's blood mixed with waste. I don't know what I get. Now, at that point in time, when the woman is supposed to menstruate and it doesn't happen that way, what happens?
Infection.
And when infection comes in, what happens? It's enough fertilizer for things to happen. Growth starts coming in, fibroid starts growing easily, and so on and so forth. So there is a way you need to make sure at all costs you take care of it.
Because there are seasons where the cases I've had of someone that's given birth, right? And then after the 2 weeks of bleeding for delivery, then they have their periods for like 6 months, and the periods just disappear without even using the family planning. Yeah, they disappear like for a whole year, then they will come back and they become regular.
Okay. Now, this is the situation. I said, first of all, take note of this. People differ in systems. My system might not be the same as his. Likewise, your system might not be the same as ours. Okay? But on this topic of family planning that we are talking about, we must put into consideration that it affects us in one way or the other. And we try to see how we can deal past it. Okay, so as I said, there's a change of menstrual cycle. It can lead to a light period or amenorrhea, and after some months of use, some women experience irregular bleeding or spotting during the first few months of using it. So it depends, it differs.
Yeah. Okay. Now, breastfeeding, is it a form of family planning? Because a lot of people say that because I've just given birth and I'm breastfeeding, I cannot get pregnant.
Come again?
Breastfeeding, is it a form of family planning? There are people who say that when they're breastfeeding, like that is how our mothers used to do it, like they're breastfeeding, they will not get pregnant at that time until the baby stops breastfeeding.
Listen, breastfeeding, let me answer this question this way. Yes, breastfeeding can be a form of family planning.
Okay.
Specifically through the method known as the lactational amenorrhea method.
Okay.
Okay. That's the LAM product, the LAM method. The lactational amenorrhea method is a natural temporary form of contraception that relies on the hormonal changes. Take note, it relies on the hormonal changes caused by exclusive breastfeeding to suppress ovulation, whereby preventing pregnancies. So it is possible.
But it's not effective, it's not 100.
It's not 100, but it also is a form.
It can.
Yes, it can be a form up to 80% yes. Because, okay, don't laugh, but I breastfed for 7 years. Okay. And please, gentlemen, if you still tell me you're not breastfeeding till today, that means you're not doing the right thing.
Yes.
Yes, because we still need to breastfeed till we go home. Yes.
Who is breastfeeding you? Okay,
I might have breastfed for my mother for 5 years, or my mother's for 5 and 2 years, respectively. What about my wife? What about my girlfriend?
Yep.
You understand? Now, let me just chip in something very funny but simple. Number one, put it into consideration. Take it known that it is necessary that you women let your men massage your breast, suck out of it from time to time. It is medically proven and it's sure. Okay?
It helps breast cancer.
Yes, it does. It does. It reduces breast cancer. And please, let me use this opportunity to tell women some things. Avoid putting phones on your breast, metals on your breast, money on your breast, etc. Avoid it if you don't want to see that your breast is cut off after some time. Avoid it. Radiational effects, the metal reactions to the skin can cause problems. So be very careful. Be warned. Now, another thing is, when it comes to the breast is a very nice topic.
We'll talk about this. Hold that thoughts. We'll talk about the breasts. We'll talk about the breasts. So, is there a family planning method available for men, or it's just a woman's burden?
No, the men. There is family method applicable for men.
Mm-hmm.
But as men, we don't really always want to indulge into it. That's one thing I have known. But now let me speak on a medical point of view. Yes, family planning is not just for women, not just a woman's responsibility, because there are various several family planning methods available for men, and men can play an active role in managing reproduction. Okay, and you see, for example, let me just try to list some. There is the male condom. Okay, there's a male condom that you use, and that's part of family planning, right? But we men, some of us will prefer to go direct and not use it. So there is also a vasectomy. Okay. Now where the man they will have to like, okay,
let's cut off the balls.
Cut off, no, not the balls. It's not the balls. It's just a vaccine. It's just a minor surgery. It doesn't take long. Okay. And it helps to permanently restrict the man from giving birth to bed. I know a case of a guy who did it, and then his girlfriend came and told him, "Honey, I'm pregnant."
He didn't tell
his wife came and told him, "I'm pregnant," of which is not true. So it happens, and he didn't tell the wife, yes.
Okay. Why don't men tell their wives when they do vasectomy? That is a man who wants to know if the wife is cheating.
To know if the wife is cheating.
That is not fair.
It's fair.
It's not fair. You sacrifice your whole life just to know someone is cheating.
It's not fair to you, but sometimes it happens. What about a man who has been, he has not done that yet, but
he has low sperm count.
He doesn't even have low sperm count. At one point, he is a father of 4 children. He has trained them up to university just to notice that the 4 children are not his when they ask for blood donation.
Amen. You see, it's only the woman who knows the father's.
Some of those things are things that we will really talk about in detail. There is also the withdrawal method, which I talked about. You can to avoid, and you don't pull it out. There is also the main hormonal contraceptives, but it is still at its experimental stage.
For the men?
Yes, it is still at its experimental stage.
Do you think if it comes out, they can use it? They can agree to use it?
I don't think so. That's my view. That is my view. Okay. A man can sleep with 100 women. A man has, okay, you see, when a man discharges or releases once, okay, he has 300 billion cells. Those are 300 billion babies. Do you understand?
Yeah.
A woman
releases only one.
Releases 1 egg. Do you understand? So a man is a multiplier. Is a mass creator. You understand? But a woman will just like, okay, after I want sex. Oh, is it? It's not food. It is food for the men. You understand?
Yeah.
It is food for the men. It is natural. A man can sleep continuously with how many women? It's normal. So which man do you think wants to?
It is family planning, not cutting off. Not doing the...
Now, the experimental side of it is something that we need to be very cautious about. Because one thing that gives Africa our land is our population. So if you try as much as possible to eliminate our population. So as for me, father to many, and I'm happy for that. And I want to be
a father
to multitudes.
3 billion. Okay. So what happens in the case where a woman is tired of family planning, right? They're so tired of the implants and all that and everything. But the man will not agree to use, say, condoms or withdrawal is risky.
Even the opportunity to have multiple wives. When you are tired, he goes to the next.
Thank you. That one is okay.
No, that is just, let's be realistic. If you want me to tell you, go by the books, I'll tell you, okay, let's go with open communication, talk with your partner, discuss the issue, express your concern, explore alternative contraceptive options, long-acting reversible contraceptive. You put all that into consideration, non-hormonal methods, you put it into consideration. But it's simple.
Let him have multiple.
Give the man a chance. It is better you know your co-wife. Give the man a chance to do what is right. Okay? When you are tired, the other lady is ready. Good. When she is tired, you are ready.
Who is taking care of these children?
Now, that is one thing that we must talk about.
That is the problem.
If you are looking only about the financial obligations, don't indulge. If you are looking at the children, if you are looking at the monies involved, don't go for it. But if you know you have the capabilities of taking care, that is why men, I would advise you work and get much money.
And get some more women.
Not more women, but if your wife is not able to continue,
you get another one.
Yes, but still respect her.
The man is not the problem. It's the woman that will bring drama. In that aspect, it's the woman that will bring drama. That is a very...
So, like I said, if you're going by the books, okay, you have to explore other contraceptive options. You also have to consider permanent contraceptive options, like you, the woman now. You can just block the fallopian tube. You don't want it anymore. Once and for all.
But it's
the tube ligation.
The tube ligation. There are some... Okay, let me talk about Kenya because I'm in Kenya now. There are some concerns that if you go to a Kenyan hospital and they say you're below the age of 45 and you want tube ligation, they will not permit it.
Yes, because people are bound to change their minds.
Okay.
It's normal. People are bound to change their minds.
Okay.
So, you think about mediation and counseling, couple counseling, family planning, all those things, and legal and ethical. The truth is, in a nutshell, we need to agree to disagree, and to disagree to agree.
There is no one straight path to this. Okay, so let's go to our last question. What are the myths and misconceptions around family planning?
They tell you that family planning, these misconceptions about family planning can lead to confusion, and you tell them how some of the myths are birth control pills can cause infertility. Okay.
It doesn't cause infertility. It just delays fertility.
It can cause.
It can cause.
It can cause infertility.
Okay.
Reality, birth control pills do not cause permanent infertility. They work now. These are the myths behind it. Okay? Now, the myths are birth control pills cause infertility. But in reality, birth control pills do not cause permanent infertility. Take note of permanent infertility. They work by temporarily suppressing ovulation. Fertility typically returns to normal soon after discontinuing the pills. It depends on what option you're taking. Now, addressing this myth, educating individuals about how to hormonal contraceptive work. That's one thing we need to do. Another myth is the IUDs are only for women who have had children. Reality is IUDs are suitable for women regardless whether they have had children or not. Okay? And both copper and hormonal IUDs can be used by women with or without pregnancy, prior pregnancy. Okay? Now, the third myth is contraceptive cause weight gain. Reality is weight gain is not a common side effect.
But it can.
It can.
Okay.
But most contraceptives. Now, see something. Weight gain is not a common side effect of most contraceptives. Now, some hormonal contraceptive might cause mild changes in weight for a few women, but this is not just the case for everyone. That is why I keep telling you, cases differ,
Yeah.
systems differ. And then another myth is contraceptives are harmful to health. And reality is most contraceptives are safe as well tolerated. Okay. While the method of the side effect, the risks are generally outweighed by the benefits for most individuals.
Okay.
Okay?
Okay.
So, hormonal contraceptive leads to cancer. Now, this is a difference. Now, the reality is hormonal contraceptive may have a small increased risk of certain cancers, e.g. the breast cancer, but they also reduce the risk of others, ovarian and endometrial cancer.
Okay.
Should I give you one more myth?
Yeah, sure.
Contraceptives are only for women.
It's a myth. It's not only for women.
Yes,
For men.
that is. But the reality is contraceptive options are available for men, including condom, vasectomy, etc.
Okay.
Natural family planning methods are ineffective. That's a myth too.
So I mean, it's ineffective.
Natural family, yes, planning methods are ineffective. But the reality is, when used correctly, natural family methods such as fertility awareness can be quite effective.
Okay. Okay. That's interesting. I hope you guys have had everything about family planning. Thank you so much for your time. If you have any questions regarding women fertility, men fertility, regarding issues that are concerning your body as a man, as a woman, please comment down below. Let us know the next topic you want us to talk about, and we'll be sure to do that next time. So see you next time. Bye.